Eve.
It's our pleasure to welcome now Senator Nicole Akins-Boyd. She represents District 9, which includes Lafayette and Panola counties, serves as the chair of the Senate Universities and Colleges Committee, and also the vice chair of the Senate Medicaid Committee. Senator, how are you doing? Good to see you.
I'm great. Happy holidays to you.
Absolutely, same to you. So you guys are going to be getting back together down there at the Capitol here in just a couple of weeks. It's hard to believe it's that time again, actually less than 2 weeks, as I think you convene on Tuesday, January the 7th. Is when you'll get it all started again. In fact, I already heard the annual Coast Party is the next night, so they get that underway in a hurry. Best food of any of the events, by the way, when the
absolutely
when the legislature gets back in session. So, what are you going to be working on this year? What have you been doing? I guess in the off season, in the intersession period. I know you guys stay busy. I see these hearings and meetings all over the place. What's on your radar coming up?
Well, we've been really busy this summer. We've had women, children, and families hearings. We did about 4 days of different hearings, kind of building back up on what we did 2 years ago, seeing if all the changes that we made, how they've been implemented, what's worked, what hasn't worked, what we need to get more publicity out on, and let people know about some of those things that we've done. We've been working in early intervention, too, because we've talked about it many times with you before. We know that's a huge issue in the state, and we know that it's our largest return on investment of any education dollar we spend. So how do we get those programs out there, and how do we get kids when they're really early so that they never have to go into special education once they reach school? So we've been working on that. That's been a 2-year task force, and that is a lot of volunteers across the state of Mississippi who have volunteered their time. We couldn't have paid them for all the work that they have done on that task force. It's been absolutely incredible. And working with the State Department of Health, we think we have hopefully got some money secured so that we can really expand and make those programs much more efficient and get those services out to those earliest of kids and get them some help they need. So we've been working on that. We've also had a state mental health task force that we've been looking at, seeing how we work with students on mental health issues, because we noticed there's been an increased number of youth suicides and youth issues in regards to this, and how do we do that? And we know that's particularly since the pandemic, it's gotten much worse. So what do we do about it? So we've worked very hard across that. I think you'll be seeing legislation come forth from us on that. So I think that's really exciting with that. And then we've been working in universities and colleges too. So we will have a DEI piece of legislation. The House and the Senate are working together on that. And it's exciting to kind of hear President Trump really kind of talk about what they're looking at on the federal level with that. So I think you'll see those things go hand in hand on that. And then really just one of the things that really came out of those women, children's, and families hearings that I think is kind of very exciting is we had our state health officials when you had the Department of Health, you had the Department of Mental Health, you had CPS, and you had DHS. And one of them said that there is a lot of bureaucratic bundling in how that they administer their business. So you have to go across state agencies. So we'll have a piece of legislation in that will hopefully allow these elected officials to make things much less bureaucratic for the public. We're going to ease some regulations hopefully with that, and make sure that and have them really make those suggestions to us, so that if you want to license a child care center, you don't have to go to the Department of Mental Health. The Department of Health and DHS. You can go to one agency and get everything done that you need to do. If you want to open a psychiatric facility, you're not going to the Department of Health and the Department of Mental Health. You'll go to one agency to do that. And so there's a lot of things that can be cleared up. I think Commissioner Sanders brought it up from CPS one day. She said, among these agencies, we need to play Go Fish. and and really straighten out what we need to do on that.
Yeah.
And I think that's exactly what we need to do. So I'll have some legislation that I'll put forth to really ease bureaucracy and make it better for the public that wants to operate within the state to do their business. And we want them to do it, but without all these regulations that are so burdensome towards us. So I'm super excited about that legislation that we'll be working on.
Yeah.
So, so I think that'll be a great big help. We'll be also putting forth a bill that will license community health workers. That's something we looked at last year. We tried last year. There were some reservations. But these are individuals that have been done very cost effectively in another state and a lot of other states. And what they do is they kind of help when you have a population of people that may not be as sophisticated as some of our places in Mississippi are. They help bridge that gap and make health care much more manageable for some of those people. So we're working with Dr. Edney on that, and I'm very excited about that. Again, just helping people navigate and get to where they need to get, and at a much lower cost than using a healthcare provider, a traditional healthcare provider, to do that.
Yeah.
So that's been super effective in Texas. They've had these for a number of years, and they used them really effectively over there. So we're excited to kind of put that legislation back forth. I've got some legislation really to ease some issues on, it's something called white bagging. And what happens sometimes is your insurance provider, when you're in the hospital, won't let you use the hospital pharmacist. They will require them it be shipped, that medication, into your home. So if you're in a state where, and then you've got to get it from your home, transport it back to the hospital, so then it can be administered there. And it's because of the relationships at the PBMs, as President Trump has talked about all of that. We see that very same situation in Mississippi. And we want to ease that burden for families. When you're in the hospital, you don't need to have to be running home, getting your mail, coming back. Also, too, we know there's quality issues there. Is the medication going to be shipped at the right temperature? Is it going to sit in the mailbox too long? All of those things that just make it incredibly inefficient to deliver health care in the state. So we're going to be working on that as well. So we're real excited about some of that. And then I'm going to go back with a piece of legislation I hope to get through this year, and that's one you and I have talked about, is really make sure that our government entities are, when they're having a meeting, when they're having something, make sure that they're posting that on an open platform, whether it be on their website, on Facebook Live, really making sure that the public can see and hear those things. So, when you're in Oxford, Mississippi, and you want to watch something in Jackson, Mississippi, you shouldn't have to drive 2.5 hours from a state agency to do that. We've got far too much technology now to do that. You ought to be able to plug into your computer and watch that business that's being interacted by that state agency. So we need some sunshine in this, and I think that'll be a huge help to that. So we've put that bill in before, and some of our agencies didn't particularly like that. So hopefully this year they'll come back with a better agreement to that. Many of our agencies have gone to that, especially those that have boards and commissions, because they really want to let the public know what they're doing. So we kind of hope that we can get that through this year.
I see. So we have sort of a rule like that Lieutenant Governor Hosemann put in place, right, for the Senate with respect to live streaming the Senate's business, including committee meetings. That doesn't exist in the House. Is that correct? In some of the rooms in the House, I don't think they have the video capabilities that we do in the Senate. So some of the House meetings are done and some of them aren't done. So we've basically there's only 3 rooms, particularly in the Senate, that basically you can meet. And there's occasion where we have to use a 4th room, but it's really because of scheduling and stuff like that. Okay. But most all of those Senate meetings are open and live streamed, unless there's just an absolute emergency or something in that. So I see. And so this legislation, would it essentially mandate that for the House as well?
Well, it wouldn't do it for the House. They operate under their legislative rules or whatever, but it would make it for all the executive agencies. Okay,
got you.
And it would hit counties and municipalities. I think we have in there above 10,000.
Okay.
So, we know some of our smaller municipalities, I represent some of them, struggle a little bit with some of their technology issues. And so this would be for those 10,000 and above.
I got you. We're up against a break right now. Can you hang around with us and keep talking?
Absolutely.
All right, great. We got Senator Nicole Akins-Boyd on the line with us. We're coming right back from the Element Wealth Studio. We're visiting with Senator Nicole Akins-Boyd. So, Senator, it sounds like going to be a busy session. You ain't got but 3 months, you know. You had 4 in last year. It was 4 that seemed like 4 years rather than 4 months, honestly.
It did. And, I started my second term in the legislature last year, and the first time I was elected, it was 2020. So we got to about 6 weeks of the legislature, and that's when the world shut down. So this was my first time to go through the full 120-day session, and it did feel like 4 years in 4 months. So it was a really long session. So I'm pretty excited to have it move at the faster pace that it will this time. So.
Well, some of the higher profile issues, of course, I think you'd have to put the discussion of tax reform pretty high up on that list. And the House and the Senate, I think, have got different views on what that should look like. How do you see that going this year?
I think hopefully we are in a position to have some really great conversation and dialogue, and I really hope that we are. I think everybody's talking and really looking at it, and I'm talking to my constituents, and I'm asking them to really tell me, what is your greatest concern on taxes? Is it your income tax? Is it your grocery tax? What is it that you really are feeling the pinch about? And I think everybody's doing that across the state. We're really talking to constituents right now. I think we all know this is a coming issue that we're going to be talking about. And so what is it you see? And, and then looking at transportation. How do we long-term fund our infrastructure needs in the state? What does that look like? So we're having all those conversations, and it's a good time for all of us to be really out there, really talking to people, saying, where are your pinches? What can you see? How do you want us to be able to fund infrastructure even right now? So I think those are conversations that we're all having across the state right now, and really seeing where people are on that.
Yeah. So, What's the feedback you get, Senator, from your constituents with respect to tax reform? And I think really that sort of can be reduced down to should the state consider reducing or fully cutting the sales tax on groceries, or should it do more work on cutting income taxes?
That's what I'm getting a lot of feedback from constituents. It's interesting. I'm getting a lot of feedback on the grocery tax, just to be quite honest. Okay. I'm getting a lot of feedback that they've got to have some relief with prices, inflation at the grocery. So anyway, so I see that being that. I obviously have people that are very interested in the income tax as well, in gradual reductions, looking at that maybe as a bigger picture of how it helps the state grow. But I also have some very pragmatic people that say, okay, if you do these things, what are the cuts that we're going to see in government? What do you expect to see? And so, there's I have a very pragmatic voter base that are in my area, and so people understand the implications to that. So I think a grocery tax too. I think because a lot of that is goes back to the local communities. I don't think you'll see a full elimination of a grocery tax, because those obviously parts of that go back to the local community. So I think you would just be looking at a state portion of that as well.
I see.
So, and I think that's a little confusing for constituents sometimes in that as well. So, it's a good time to have these conversations. It's a good time to be in district and be asking people what they think about that. So, yeah. I think everybody is looking at what tax cuts we can make, and I think that's in everybody's mind right now, to see how that we lower that burden of taxes to our constituents.
Sure. Of course, serving as the vice chair of the Senate Medicaid Committee, do you expect there to be continuing discussion on the topic of Medicaid expansion in this coming session?
Yeah, absolutely. I think we are all wanting to see what the Trump administration really looks like in regards to this. It was a contentious issue last year. The Senate was absolutely committed that we would not do Medicaid unless it just to make sure there were work requirements in there and strong work requirements in there. And that is something we were very committed to, looking at health care for those working in Mississippi, with some very minor exceptions in there for those maybe who were caring for a loved one or something like that. But I think we are very interested to see what the Trump administration proposes. They had a proposal back in 2020 that they were not able to implement because of the pandemic. So we're interested to see, did they go back to that proposal, what this looks like from the federal level. I still think we are not sure of yet. And I think that's going to really play, obviously, the huge part in how these discussions continue. So I think the Senate, though, as a body, we have to have those strong work requirements in there, or I don't think you would see. I think the Senate is very committed to that.
Gotcha. What about continuing discussion on school choice and some education savings account or some changes in that? I've had the lieutenant governor on the program. It's been about 3 or 4 months, but he seems to be of the opinion that he could support possible open enrollment from a public school to public school transfer, and that's pretty much about it. What do you think?
I come from, I think that's something that people are amenable to. We want to see children that are in those poor and failing school districts be able to have some choices and not have to have those school districts release them. And so I think that's something that people are very amenable to, is allowing those students to be able to have some choice in that. Something, though, that kind of I would like to see, I have a special needs child, and so we have the ESA savings accounts that are opened for special needs children. Not the savings account, just the vouchers that are open for those children.
Yep.
And so each year there's a waiting list for those vouchers because people take them up. But what we have found is that a number of those vouchers are never claimed, that people sign up for them saying they're going to take them, and then there is substantial amount of money that is never used because people wind up not using them because they find there's not places for their children to go. I'd like us to see some modifications to that so that maybe we can ease that big waiting list and make sure that we can service more kids that are on there, because we know a certain percentage of those now, we've had a history of operating those, are not going to be taken up. So I think we need to do some modifications in there so that we can serve more kids. We budget the money each year, and then a tremendous amount of that money is never used. So let's we need to fix that. I think so, and that's an easy fix to make. We kind of know historically now how much of that is not going to be used.
Yeah, and that program's been in place for about 10 years now, I believe,
right.
Both special needs and dyslexia scholarships, if you will. But I think the House is going to push for a phasing in of universal school choice the way 3 of our neighboring bordering states have done. I don't feel like that the appetite for quite that degree of school choice exists in the Senate, certainly not by the lieutenant governor.
Yeah, I don't know that it exists tonight. I don't know. I think there's, it's interesting. I don't think that exists in the Senate. I live, obviously, in a very strong public school district. Very fortunate for that. I have some really strong public schools in my area. But I think, too, there's an opportunity to learn from some of these states that have passed the laws, haven't fully implemented all of that yet. Yeah. And so I think that it's an opportunity to sit back and see how that they implement that. In one of those states, I asked a legislator, now tell me how you're going to fund that. Very involved legislator in that state, and he said, I have no idea.
Well, Arkansas, as you know, their final phase goes into effect in 2025 in Arkansas. Remember, that was one of the first orders of business that the governor, Huckabee Sanders, took up. And that means that everyone who has a child and a student in private schools is going to receive the state portion of their education in the public schools in the form of a voucher directly to them to defray the cost of private school. We got to go about 30 seconds. What do you think?
I think I want to see how that's implemented and how they afford, like how that they are doing that and affording that. So, when my colleague from the other state, a very conservative Republican, said they had no idea how they were going to fund that.
Interesting.
When talking to me, I was looking at him going, wait, you passed something that you have no idea how to fund it? That's not good conservatism to me.
I got you.
So we'll have to see how they do that. So anyway, I think it's going to be a good session. I'm looking forward to it. I think we've got some exciting legislation to look at.
Sounds good.
And I think it'll be really exciting to see how this new federal administration,
I agree.
what they
we'll
do
see you down
and
there.
how that we respond to it.
We got to go.
So,
Happy New Year, Senator. Thank you.
You too.